Hey everyone! Oh my god. It's so nice every time we go live. So, Amani, she's been studying so hard today. Say hi to everyone.
Hello, everybody.
She's been studying so hard today. Man, she's a fighter. She's a real fighter. She's been doing an amazing job. What time did you wake up today?
Six
6?
or seven, I can't
And you've been
remember.
up since then?
No, I woke up at 4, then I slept at 5,
Okay,
then I woke
whatever.
up at 7.
So Amani did not
I have
Amani did
finished.
not review her notes this morning. She started up with questions, and that's against the Alphaslice policy. So, Romario, hey, my friend. You know Romario? He's a student. Actually, he was doing training during my BMC times. Hey, man, how you doing from Lebanon?
Let her sleep.
Adel.
Yeah, I'm not sleeping.
Good morning, ya Jamia. Good morning to you too. I hope you're enjoying your annual leave, man. Taking care of your daughter. Yeah. See what time it is?
It's
It's 12 noon.
it's obvious I'm not
No,
sleeping.
actually, it's 12 midnight. It's 12 midnight. Thank you, Romario. Thank you, man.
Thank you, Romano. Is he
Adel,
is he applying
mind your own
Romano?
business, Adel. Mind your own business. Okay, Amani, tell us about your challenges today with the NCLEX. So, how many questions did you solve today?
75.
75.
Yeah, but I studied something else. I
So you,
studied
you
cardio.
so you did not get up to the alpha slice limit, which is 100 questions per day.
I was planning to, but because I studied something else.
But it's already 12 midnight, so you didn't make it today.
No, tomorrow, hopefully.
Okay.
With Angelina.
I know. She's waking up. You can see her down in the corner. But so Amani solved 75 questions today. It was a challenge. Actually, I was off today, so I was helping her with the kids, with Noah and everything. But yeah, like, give her the pacifier. Come back. So, and just for the past hour and a half, I've been teaching her some EKG, and the blocks, first degree, second degree, Mobits 1, Mobits 2, and third degree. A lot of people get confused, but the Alpha Slice has the perfect strategies to master, the blocks. Hey, David, how are you, man? Good morning to you too. Good morning, good morning. More about the NCLEX. Does it help, Micah, man? Freaking yes.
It's
Yes,
different.
yes, yes.
Yeah.
All day long.
Are you planning to apply, Romario?
Romario is still a student, so he doesn't have the experience yet. But I mean, anyone can apply for an NCLEX. But to get to the United States, you need to have at least 1 year of experience.
He's still studying nursing back
No,
home.
actually, he just finished. He graduated.
Mm, okay.
So come on, back to you.
If he's fresh graduate, maybe he can do better because the
Yeah, yeah, yeah.
application.
The sooner you sit for your NCLEX, the better. The sooner the better because all the information is still in there. But it's different. Like it's different.
But you need to use the
Practicing
basic.
nursing in the United States, it's way different than practicing nursing, overseas, and that's very true. And today, Amani faced tons of challenges regarding that. So come on, tell us about one of the challenges that you faced today.
Psychosocial integrity questions.
Psychosocial integrity questions. Example.
Like the nurse received a call from a friend of a client who was not taking a shower for a couple of days and was not eating for 2 days. So, what is the best response from the nurse? What you would say?
What you will say to the client who's concerned about his friend?
Yeah,
Okay,
that
what
he is not taking a
what what are
shower
what are the options?
and eating the options. I forget.
So
Uh,
what's the challenge like? What's the challenge?
I did not pick up the correct answers because I'm not trained to those kinds of questions.
Okay, never mind. Just the last 2 minutes that Amani rattled. Just never mind. I didn't understand what you said. I didn't understand what you said.
Sure.
So a
Like
client, I mean,
a friend of a
a friend of a
client
client called
called the
in,
nurse
and he's concerned.
because the client
Is not taking a shower for several days.
yeah. So what is the best response from the nurse to tell this friend?
I guess it's assessment. Just assess more why he's
No,
not taking a shower.
no. Are you still opening the captain?
It's never mind. Never mind. This is live. You cannot edit it. Yahya, hey man, how you doing? Good morning to you too. Actually, it's midnight here, but good morning to you too. I know, Romario. I know you already graduated, man. What's that?
You want me to recognize six answers?
No, but I mean, I didn't understand the concept. What's the challenge behind the
Type of
question?
questions. Type of questions. You are not trained, or we are not.
I mean, we're not trained to give advice over the phone. Is that what you mean?
We did not take any course how to talk with the patient over the phone or solve this.
There's a big misconception, from like the mentality of an international nurse and the mentality of US nurse. And that is that every time you answer a question, I mean every time you get asked a question, you imagine a hospital setting. But not every question is a hospital setting. Like here in the States, you've got nursing homes, you talk to the patients. Like a patient can call in and you can pick up the phone and talk to the patient. Patient could be in a nursing home. A patient could be in his own home. So it's not a hospital setting every single time. So sometimes Amani gets confused with that.
Like one question, a toddler, an infant age kid was throwing the toy, and then every time he was throwing the toy, the parents were picking it up and and giving giving it right away to the kid.
Mhm.
Otherwise, he will cry loudly. What is the best response from the nurse should be? Like, don't forget to clean the toy before giving it back to your kid because the floor is dirty,
Dirty.
or tell the parents, I assume your kid is 11 months old and it's normal for this age
Hmm.
to do this behavior. They like to throw things and then you pick it up.
Okay.
And there are two other answers I
So
cannot remember. So
so
I put to clean the toy
mhm.
because in the clinic, no, it was not the correct answer.
What was the correct answer?
It's normal for his age to throw the
So
toy.
should the parents pick it up again?
Yeah, so in this way you don't put the parents in a frustration situation because they might be frustrated because he's doing this action.
Oh, he's keeping throwing. Yeah.
Yeah.
So that's like developmental
Yeah, but
growth or process
we
or
will not
whatever.
think about the frustration. We will think about infection.
Yeah, I mean you would think about infection. Adel, my friend, Amani, I mean she's not supposed to do the IELTS. She has a green card. She can't get her NCLEX without IELTS. She can't practice NCLEX without IELTS.
Because they said if you tell them that.
Hey Noah, how are you? I know you're working tonight,
Because they said
or you just got off work.
if you tell them that you have to clean the toy, it's arrogant that you are telling them as if they don't know that the floor is dirty. So you don't have to tell them this.
Hmm.
See, the way of thinking is completely different.
Hey David, no, she's not using UWorld.
I'm using Kaplan.
Adel,
No, how are you planning?
you can talk to her in private. David, HIPAA. Yeah, you're asking questions about HIPAA or what? We're not. We're just discussing imaginary patients. We're not discussing real patients. 5428. Yes, NCLEX is recognized in Canada. Actually, Canada, they're doing NCLEX as well for their licensing. Destiny, hey, my friend. So Noah just wake up because we were talking. No, I'm just replying to comments. So Amani is telling me to let her talk. You can talk, dear.
No, I don't want to talk. When I was talking, he interrupted me.
I'm sorry. This is just the Arab mentality to interrupt, keep interrupting. So, like I mean, you don't have real challenges like today. I know you have real challenges, but you didn't tell me any real
I got
challenges.
53%, the total of
Okay.
my
Next time when we go live, please put real challenges to share with everyone.
real examples.
Real
You want me to
examples,
write
yes,
real
of course.
examples?
Anyway, one of the questions was about what was it about? The insulin, like to draw insulin, draw the fast acting insulin first, and then draw the long acting insulin, and you have to ingest air first. You know that type of. I mean, what the heck are you talking about? Like back home, you just draw insulin from whatever. So yeah, they have a specific algorithm and stuff like that, and that's very important. Like when you're practicing, that's a medication error if you mix things up.
Or if the patient tells you he doesn't want to be giving NG tube feeding, then what you will tell him if he's going like a palliative treatment or like this? So what you will tell him?
Mhm.
So he has to have um, advance what we call advance
Directive.
directive.
Yeah, every patient like
It's new information for
when
us.
he first gets admitted to the hospital, there should be an advanced directive discussed with the patient. So like DNR, what are what are practices that he accepts, like he doesn't want to be fed, or he doesn't want intubation in case he got intubated, or he doesn't want a CPR, or he doesn't want aggressive treatment, he doesn't want DC shocks, whatever the case might be. That's called an advanced directive, and the patient has the right to be asked about advanced directives on admission, and of course he can change them at any time. So what one of the questions I remember, Amani, when they said when they were talking about mixing tablets of medication in the food of the patient, like without him knowing that you're mixing tablet. Like if you have a patient with dementia and you want him to take his meds, so sometimes you mix the tablets in a pudding and you give it to the patient without him
It's
noticing.
not allowed
But yeah,
it's
that's
illegal.
that's illegal. It's unethical, and the POA. What's the POA? Patient. What's the POA? Patient.
It's
It slipped my mind. Anyways, so the POA has to approve you giving him the medication. That's the advisory of the patient. Like who takes this decision um, on behalf of the patient if the patients are mentally if their cognitive status is not 100%. So so yeah, that's illegal. That's unethical. So if a patient, like if I want to give PO medication to a patient and he is he has dementia, I cannot give it. I'll just chart medication not given. Patient is not with is not with an appropriate cognitive status or whatever. So you cannot give PO medication to a patient without him approving it. Yeah. Welcome to the States.
signs of abuse, child abuse, or adult abuse. Some old adults they are abused by their children.
Mm.
So you have to guess what are the signs
Signs
of
signs of abuse,
abuse.
of course.
Yeah.
Any examples? No.
Signs of abuse.
Of
For
course,
for
bruises, being fearful,
malnourished
malnourished,
older adult.
not talking in front of the kids, or whatever. Healthcare proxy is what you try. No, no.
Yeah, yeah, it's healthcare proxy.
is what you're trying to remember. No, no, the POA is the patient,
Healthcare proxy
and
is
the A
the
is
one
that,
you sign for
yeah,
the
yeah, but
advance.
POA, there's an abbreviation for POA. P is patient, and A is attorney. But patient and the O, I can't remember it. But
Autonomy,
uh,
authority.
anyways, okay. So Annie doesn't have any challenges today, or
Oh,
she had a lot of challenges, but she cannot express them.
psychosocial questions.
So, but I mean, I didn't understand psychosocial questions. Anyways. So, I mean, for me, you did a great job today because you completed 75 questions, even though you started on a wrong pace. I would like you to review your notes.
Give me more time.
Yeah, no, you start by reviewing your notes, then start solving questions, 100 questions per day. If you didn't get to the 100 questions, it's okay, but at least you mastered your notes. But there's one thing which is good that we did today is reviewed ECG, and now you can get back to them whenever you have it and like ECG questions. So that's it. Um, we're not gonna like stream for a long time just because there's no content. And Amani is sleepy. I'm sleepy as well. I'm working tomorrow. All right. Thank you guys. Please, if you have any comments, like the other day, Samah gave us a very amazing.
Yeah, thank you,
She
Sama.
sent she sent us an
She's not
amazing.
online.
She sent us an amazing audio lectures from this smart guy, and I need to listen to them.
Like steps how to follow a strategy to get to the correct answer.
Amazing tips. She loved them. They helped us. They helped her a lot. She's feeling more confident today, right? You're feeling more confident today, which I like. And thanks for your help. Please, if you have any tips of how she can time manage with three kids, two boys, one naughty boy, actually an angel, a naughty boy, and a newborn. If you have tips and ideas for time management, please put them down in the comment section and wish her luck. I wish you luck, dear. All right.
Thank you.
Thanks, everyone.
Thank you, Sama.
Bye.